On March 11, 2011, at 2:46 p.m. local time, a 9.0 magnitude earthquake struck 43 miles off the coast of the Sendai province in Japan, east of the Yoshika Peninsula, Otohoku. It was the most powerful earthquake ever recorded in Japan and the fourth most powerful in the world since 1900. Geologists estimate it literally shifted the Earth on its axis by about 7 inches and changed its rotational speed. It triggered powerful tsunami waves that reached heights of 133 feet, and in the Sendai province traveled 6 miles inland with waves 33 feet high. The epicenter of the tsunami reached 500 miles per hour. Concerned researchers at the Child and Adolescent Psychiatry Department of the Kodaira Hospital, affiliated with the National Center for Global Health and the Department of Psychiatry at the Kumamoto, Japan, chose to study the impact of this traumatic event among the children who survived. The aim of the study was to evaluate relationships between traumatic symptoms and environmental damage conditions in children 8 months after the earthquake and the tsunami. The aim of the study was to evaluate relationships between traumatic symptoms and environmental damage conditions in children 8 months after the earthquake and tsunami. Researchers distributed 2 questionnaires to kindergartners, elementary schools, and junior high schools throughout the nearby Ishinomaki city, where many of the survivors had moved. The recruitment letter told parents that the results would be used to provide children with psychological care to facilitate their education. To evaluate the stress and trauma to the children, the researchers created a measurement tool they named the Post-Traumatic Stress Symptoms for Children, also known as the PTSSC-15, a self-completion questionnaire. This questionnaire is an extension of similar screening tools and consisted of 15 questions with responses limited to 6 levels of agreement. This questionnaire was self-completed by the subjects in 4th grade through junior high. For the younger children, the parents were asked to fill out the questionnaire while talking to their children. An environmental damage assessment questionnaire was distributed to the teachers to provide information on house damage, evacuation levels, and bereavement associated with each of the children. The tsunami caused tremendous damage and victimized a number of children. These children experienced physical displacement, evacuation, and in many cases witnessed loss of their own home, and most traumatically, loss of their family. After any disaster, post-traumatic stress disorder, also known as PTSD, it is the psychiatric diagnosis that should be considered most carefully in these events. In this study, the researchers considered a PTSCC-15 score of 23 to be significant and indicative of the presence of post-traumatic stress disorder or being at high risk of PTSD. The mean score for all return results was 20.5, less than 23, the level the researchers considered significant. Mean scores were higher in girls, especially in the older age groups. Scores were higher with those that had experienced house damage, evacuation, or loss of relatives. Scores were also consistently higher in the older age groups than the younger age groups, indicating the younger children were impacted less or retained less stress, even for comparable experiences. Of course, since the parents filled out the responses for the younger children, there is a possibility that not only the status of the children, but also the psychological anxiety and status of their parents affected the responses. And finally, as we'd all expect, the bereavement experience, that is mourning for the death of their family, was closely related to traumatic symptoms of the children. In particular, children who lost their mother, they had recorded higher levels of post-traumatic stress disorder.